A trauma is part of the patient experience because we coordinate the care of the trauma patient. Basically, we oversee your care to make sure that everything is done correctly and that we follow all the trauma protocols that we have. We use ATLS, which is Advanced Trauma Life Support.
It greatly impacts the patient experience because we make sure that they are basically have everything set and ready for them when they go home so that they'll have everything they need to manage their illness outside of the hospital. I feel that we have a little bit more time that we can sit down and talk to them, you know, about emotional support as well as, you know, medical things.
You see people that are down and almost out, and by the time they are leaving here, we put smiles on their faces. That makes my job great for the day when you see situations like that.
You see a whole lot of successes. You see people come in psychotic, anxious, depressed, suicidal, addicted, and even though this is short-term acute care, you get to see that progress through that. They're leaving at a higher level of function when they came in, and they have a few more tools to follow up with when they leave, and that's really satisfying.
The team approach here is excellent compared to other places I've had the opportunity to be in the city. The team really works together to help the patient be the best that they can be, and we involve the patient in that planning as well as make it happen for them.
The main thing would be the patients. Because many times they're very sick, and then in turn they're scared about their financial situation, and so it's really nice to be able to kind of lay everything out for them and let them know that it will work out and we'll find a way to get things paid for and get them the care they need.
It gives them a peace of mind, you know. They could be coming in and having, you know, serious conditions going on, so they're worried about their condition, they're worried about their family, because if they've stopped working, what's going to happen there? And then they're worried about all the medical bills that could happen. So if we're able to take away even one worry, then that's a big accomplishment just right there. We're all in this together. It's the camaraderie and the teamwork and you know, my staff helping out wherever needed, whenever needed, at a moment's notice. So, and seeing all the compassion that they show for our patients.
Truman Medical Center does a great job of reaching out to the Lee Summit community. We do some of the normal things that a hospital would do, and then we do a lot of things that that other hospitals wouldn't do. We reach out into the community and really go out and help patients and help them know about the resources that we have available to them.
I did a complete medication history with her, kind of told her what she needed to be on, how to take it, and then she understood her therapy a lot more. So it was a great impact for me, just because that little bit of education that I provided her completely made a difference in her disease state outcomes. Absolutely, it decreases her chance of coming back. It helps her just feel better, live her life a little bit better every single day.
Not just on this unit, but Truman in general, we, the employees here, we really care about our patients. And so, you know, we might have challenging days, but in the end, you know that when you go home, you've done not only what you wanted to do, but what you know you needed to do to serve our patients.
It's amazing what the doctors do here. But they perform miracles that I never would have ever thought could have happened. And I've worked in other psych places, but there's nothing as phenomenal as there is here. I know the elderly have lived their life, most of them to the fullest of their potential, and they just need a little bit of encouragement and help along the way to, you know, give them the extra care that they need.
Every morning we discuss patients' progress, what's happening with them, whether the medications appear to be working, how their discharge planning is going, do they have a safe place, all that, you know, and that's the coolest part.
People that comes here 90 years old, older, they live their life, and at the end of the day, they just need someone to care for them and love them. You'd be surprised what they say to you. I mean, something like they just make your day. You smile and you say, "Oh, I never expected that," but it makes your day and get you going. Come back another day, do it again.